Hello guys, welcome to our YouTube channel Khama Bangla. Today we are discussing about measles and rubella. Actually this is a handbook and it is published by the government of West Bengal to make awareness against these diseases. Okay, let's start the video. The government of India has decided to introduce a combined measles rubella MR vaccine. The vaccine will be introduced through a campaign followed by inclusion of the MR vaccine in the routine immunization program. This will replace the measles first dose and second dose vaccines. The MR vaccine will be introduced in all the states across India in a phased manner. The MR campaign targets all children between 9 months to less than 15 years of age, regardless of immunization status for measles or rubella. What are measles and rubella? Measles is a deadly disease, one of the major causes of disability or death in children. Measles is highly contagious and spreads through coughing and sneezing of an infected person. Measles can make your child vulnerable to life-threatening complications such as pneumonia, diarrhea, and brain infection. Measles is commonly recognizable as a visible red rash with high fever, cough, runny nose, and red eyes. Now we look what is rubella. If a woman gets rubella infection in early pregnancy, it can result congenital rubella syndrome (CRS), which can have severe and fatal consequences for the fetus and newborns. Children of unprotected mother having rubella infected during early pregnancy have highly chance of suffering from long-term congenital anomalies affecting the eyes, glaucoma, cataract, ears, hearing loss, brain, microcephaly, mental retardation, and heart defects. Rubella can also lead to abortions, miscarriage, and stillbirth in pregnant women. Next, we look what is Measles Rubella campaign. Measles Rubella campaign is a special campaign to vaccinate all children in a wide age group with MR vaccine within a limited time frame in an entire state. The MR campaign thus will be given to all children present in the state during the campaign period who are within the age group of 9 months to below 15 years old. Both previously vaccinated and unvaccinated children will be covered. The goal of the MR campaign is to quickly make the population immune from measles and rubella, to reduce deaths from measles and burden from CRS, and to immunize maximum children with at least 95% vaccination coverage of the target age group in the community. Who should be vaccinated? All children who have completed 9 months and are less than 15 years of age, regardless of previous vaccinations status with measles rubella vaccine, and regardless of measles rubella infection disease in the past. Malnourished children should be given priority for vaccination as they are more likely to have complications like diarrhea and pneumonia. Children with minor illnesses such as mild respiratory infection, diarrhea, and low grade fever. Why should children in the age group 9 months to below 15 years be targeted? Majority of measles and rubella cases occur in children below 15 years of age. Therefore, this age group is being targeted during the campaign. Where will the children be vaccinated? From fixed post only, no house to house vaccination. During the first week in schools, non school going and left out children will be vaccinated in the following 2 weeks in fixed outreach sessions and mobile posts in village and urban area. If at any place 4 or greater than 4 children have been found missed during rapid convenience monitoring, the MR campaign activity should be repeated in the area during 4th week of MR campaign to cover these missed children who should not be vaccinated. Don't vaccinate a child who has high fever or serious disease like unconscious, convulsions, etc. Hospitalized children, history of a severe allergic reaction to measles, rubella vaccine in the past. Guideline for issuing invitation cum vaccination card. In consultation with ANM, the ASHA must make plan to deliver field vaccination card with information about session site, date and time to every beneficiary giver in the week before the campaign. One card is given per child, so more than one may be given to a household. Ask household members to bring the cards to the campaign site when they bring their child or children for vaccination. Invitation card will be used for recording vaccination also. Keep extra card at session site in case parents forget to bring it along. Develop a plan with ANM to organize village level meeting for social mobilizations through effective interpersonal communication. Number 3. Decide on the dates for the meeting in each village at least 1 month before the campaign so that the ASHA or Anganwadi worker organize the meeting and the ANM also practices as a team leader for her vaccination team. And it is measles and rubella vaccination invitation and vaccination card. Next, guidelines for holding community meeting. Number 1. Hold meeting at a convenient time and place after consulting leaders. Number 2. Identify local community representatives for the meeting. Number 3. Provide a comfortable and welcoming environment for discussion. Number 4. Listen to the community and find out what the community already knows. Number 5. Provide information on the importance of MR routine immunization. Number 6. Dispels misinformation and doubts that surround vaccination. Number 7. Encourage community members to ask questions. Number 8. Convey keys, message or aimer and the campaign to participants. Number 9. Motivate caregivers to participate in the campaign during house visit for beneficiary listening and invitation. Next, during session days, visiting the houses of missed children to mobilize them. Site. There will be 4 types of sessions site during the catch up campaign. Number 1. Session sites at educational institute like school campaign. Outreach session sites, regular RI sites and additional sites in village and urban mohalla. Number 3. Mobile team to cover hard to reach area, nomadic population, temporary settlements. Number 4. Facility based session site at PHC, CHC, hospital, private clinic. Next is duration of session. Sessions in educational institution Sessions in educational institution will run as per school timing to complete all vaccinations in a school in one day. Microplanning will be based on 200 injections or single vaccinator. Number 2. Campaign sessions at outreach and fixed sites will run from 8 a.m. to 200 p.m. The vaccinators and ASHA AWW will then perform their other routine activities until 4 p.m. at the site. Mobile or special vaccinators team may have to work at unusual hour to reach special population group. The member the time of activity for each day and area should be pre-planned and must be specifically recorded on the microplan for such flexi timing activity accordingly. Number 4. Facility based session site PHC, CHC, hospital, private clinic will work during the whole duration of campaign from 8 a.m. to 4 p.m. Instructions to cold chain handlers. Analyze the available stocks of measles vaccines at all levels at least 4 months in advance of the campaign. Any excess stock which cannot be utilized before the MR campaign has to be surrendered at least 4 months in advance of the proposed MR campaign. Number 3. Even if some cold chain experiences measles vaccine stock out just prior to campaign, it should not be concerned as measles containing vaccine will be provided during campaign, as well as these missed children will have the window to get the measles containing vaccines under routine immunization at a age of 9 to 12 months and 16 to 14 months. In spite of all these measures, if measles vaccine still remain unutilized by the start of MR campaign and diluents and seal them in boxes separately. Next, sealed box of measles vaccine to be stored inside ILRS and sealed box of diluents to be stored outside in the dry space. Next, no measles or MR vaccination to be done in routine immunization during MR campaign. Next, stored measles vaccines and diluents in sealed box to be used after and MR vaccine to be given as second dose as 16 to 24 months after the complete measles vaccine stock is utilized. MR vaccine to be given as two dose schedule at 9 12 months and 16 to 14 months. Only 10 dose diluent provided with MR vaccine to be used for reconstitution of MR vaccine. Vaccine administrator. MR vaccine is available as a dry powder which has to be reconstituted using only the diluent provided by manufacturer. The dry powder is one vaccine vial must be dissolved using the entire amount of 10 dose diluent in one ampoule. Proper cold chain precautions must be maintained at all stages of vaccine handling, storage, and administration. Reconstituted vaccine must be discarded within 4 hours or at the end of session, whichever is earlier. Each vial contains 10 doses. The dose is 0.5 ml for all ages. The vaccine is injected by the subcutaneous route. The site of administration will be the right upper arm. Before reconstitute, check the expiry date on the label. Do not use if vaccine has expired or label is solid or missing. Number 2. Check VVM or seal of vaccine vial. Do not use if VVM has been removed from the cap or VVM is not usable stage. Next, check expiry date, diluent ampoule. Do not use if diluent has expired. Next, check that both diluent and vaccine are from same manufacturer and the label on diluent vials states that the diluent is for MR vaccine. Check that both diluent and vaccine vials are free from visible dirt outside and that no extraneous particles are visible inside either vaccine or diluent vial. Check for any visible cracks in the vaccine vial or diluent. If you find any, then use a fresh vial or diluent. Next, check that cold chain has been maintained for both vaccine and diluent are both at all the same temperature. Next is during reconstitute only one vial at a time. Use entire amount of 10 dose diluent provided in the ampoule to reconstitute 10 dose MR vaccine. Use a new reconstituted syringe for 5 ml to reconstitute each vial of vaccine, maintaining full aspects precautions. Do not use the same syringe to reconstitute vaccine in another vial. Dispose of needle cap and outer packaging in black plastic bag as per routine RI practice. Do not touch needle or rubber cap during reconstruction. After reconstruction, the vial should not be rolled between the palm. The vial should be shaken gently upside down a few minutes, holding the neck and for mixing appropriately. Cut the whole of the reconstruction syringe with a half cutter. Dispose of plastic part of reconstitution syringe in a red plastic bag. Record time of all reconstitution or MR vaccine vial level. Use only AD syringe to administer vaccine to every child. Never prefill and store AD syringes before vaccination. After reconstitution, always keep only one reconstituted vaccine in the hole in the ice pack to maintain temperature at 2 to 8 degree Celsius. Keep the reconstituted vaccine out of direct sunlight. Never use reconstituted MR vaccine beyond 4 hours after reconstitute. Using MR vaccine beyond 4 hours after reconstitution may result in toxic shock syndrome TSS leading to death. Never carry or use constitute vaccine from one session site to another. Injecting MR vaccine. Only AD syringes to inject vaccine. Dose is 0.5 ml for all ages. After injecting MR vaccines, do not attempt to recap or bend needle. Cut the hub of AD syringe in hard cutter. The cut needle should remain in hub cutter until disposed of at a designated site in a safety pit available at the PHC, CHC and hospital. Dispose of the plastic part of the cut AD syringe in the red plastic. Make left thumb on the child after vaccinating. Mark tally sheet one at a time after vaccinating child. Give vaccination card to child after vaccination. Child should wait for at least 30 minutes after injection at session site. At the end of each session, use the given format, record all the vaccines, vials, diluent, syringe received and utilized. Remind about scheduled routine immunization. Does a proper inform that the nearest place of day of RI session is in your village. All ANMs will get 2 vaccine carries. At session site, take out one ice pack from the second vaccine carried to keep one vial of reconstruction vaccine in the whole of the ice pack. MR vaccine is very sensitive to hurt, to heat and sunlight. Never expose the vaccine carrier, the vaccine vial or ice pack to direct sunlight. Once the reconstituted vial is finished, take out the next vial from the vaccine carrier for reconstitute only after arrival of another child in the vaccination session site. If another child is waiting for vaccination, the WM on the top of MR vaccine indicate whether the dry vaccine is usable or not. Once reconstituted, WM is no use to indicate the usability of the vaccine. As the end of the session, sent back all the vaccine carriers with all ice bags, unopened vaccine vials and inside to the vaccine distribution center. Management of AEFI at the session site. AMR vaccine is an extremely safe vaccine, but like all medicines, including vaccines, it does have some side effects or adverse effects. The more common adverse effects are mild and have no long term consequences. One very rare and serious adverse effect is anaphylaxis. It is important that vaccinators should be able to distinguish anaphylaxis from fainting, anxiety, and breath holding spells, which are common big reactions. The following table describes how to differentiate between fainting and anaphylaxis. Onset usually at the time or soon after the injection, usually some delay between 5 to 30 minutes. Skin pale, sweaty, cold, and clammy, raised and itchy rash, swollen eyes, face, generalized rash. Respiratory, normal to deep breath, noisy breath from airway obstructions. Cardiovascular, decreased pulse rate, transient hypotension, increased pulse rate, hypotension. Gastrointestinal, nausea, vomiting, abdominal cramps. Next, neurological, transient loss of consciousness, good response, loss of consciousness, little response, one prone. How should the adverse effect be managed? Supervisor ANM, ASHA, AWW should know the name and telephone number of the nearest AEFI treatment or management center, including in the microplan. Next, the minor AEFI like fever, etc., treat with paracetamol as per INMCI guidelines. For serious or severe AEFI, as example, convulsions and anaphylaxis, give primary care. Lay child flat, ensure airway is clear. If child is unconscious, put in semi-prone position. Next, refer immediately to the nearest AEFI treatment or management center. Call the AEFI treatment management center and inform them of the referral. Inform the immediate supervisor and block medical officer. Injection safety and safe waste disposal. Use new sterile packed AD syringe for each injection for each child. Do not attempt to recap the needle. The practice can lead to needle strike injury. Stick injuries. Cut the hub of the AD syringe immediately after administering the injection using the hub cutter. Store broken vials in the same hub cutter. Segregate and store the plastic portion of the cut syringe, and unbroken but discarded vials in the red bag. Send the immunizations waste generated in the outreach session to the PHC for further disposal as per CPCB guidelines. Role of team members. Vaccinator prepare microplan of their respective area villages and ward, participate in training and inform, motivate AWW ASHA to attend orientation training. Next, ensure AWW or ASHA prepare due list and distribute invitation cards in their areas. Next, inform or contact community leaders PRI to make campaign successful. Next, maintain cold chain and follow safe injection practice. Dispose waste safely as per CPCB. Record campaign does in tally sheet. Supervise and guide other team members, ASHA, AWW volunteers. Wait for 1 hour after vaccinating the last child at the site to respond to AEFI. Ensure vaccination of left out children during and post MR campaign. ASHA, AWW. Participate in orientation training at PHC. Distribute invitation come vaccination cards to parents at least 3 days prior to the campaign. Mobilize community and parents to bring target children for vaccination. Mark left thumb of vaccinated child. Ask each beneficiary to wait for half an hour after vaccination. Mobilize missed children to a nearby session site. Next, plan and display IEC materials to enhance visibility of the campaign. Next, after the campaign is over, identify left out children and help ANM to immunize them on RI sessions or nearby fixed session site. Volunteers, crowd management, telemarking for vaccinated children, remind parents of eligible children to complete routine immunization, mark left thumb of vaccinated child, give complete invitation, come vaccination card to the child, help in mobilizing all age eligible children from the community to the vaccination session site. Part 2. Frequently asked questions on measles. What causes measles and rubella? Measles and rubella are caused by a virus. How does measles spread? Through the air infected droplets and is highly contagious. How does rubella spread? Through airborne droplets when infected people sneeze or cough. Pregnant women may pass the virus on to their fetuses. What are the symptoms of measles? Fever and a rash, cough, runny nose, redness in eye. What are the symptoms of rubella? In children, the disease is usually mild with symptoms including a rash, low fever, nausea, and mild conjunctivitis. Swollen lymph glands behind the ear and in the neck are the most characteristic clinical feature. Infected adults, more commonly women, may develop arthritis and painful joints. How long does it take to show sign of measles after being exposed? It takes about 10 to 12 days from exposure to first symptom, which is usually fever. Measles rash appears approximately 2 to 3 days after the fever begins. How long does it take to show sign of rubella after being exposed? When a person is infected, the virus spread throughout the body in about 5 to 7 days. Symptoms usually appear 2 to 3 weeks after exposure. How serious the measles? Measles can be serious disease among very young children less than 5 years of age and adults more than 20 years of age and cause death due to complications of diarrhea, pneumonia, and brain infection. How serious is rubella? In children, the disease is usually mild, but when a woman is infected with the rubella virus early in pregnancy, she has a great chance of passing the virus on to her fetus. This can cause serious consequences for the fetus like miscarriage, stillbirth, or severe birth defects known as CRS, congenital rubella syndrome, causing defects in heart, eyes, ears, brain, etc. An infant with CRS can excrete rubella virus for more than a year and is infectious to others to the community. What are the possible complications from measles? Diarrhea, pneumonia, and encephalitis account for 60% measles related deaths. What are the possible complications from rubella? Children with CRS can suffer hearing impairments, blindness, heart defects, and other lifelong disabilities. Who are at risk of getting severe measles? Person with low immunity, malnourished children, and with A deficiency. Who are the people at risk of getting rubella? Children or adults who are not vaccinated, or a person who has not been vaccinated and comes in close contact with infants who have CRS rubella. Is there treatment for measles and rubella? There is no specific treatment for measles or rubella. People with measles need bed rest, lots of fluids, and control of fever. Patients should receive 2 doses of vitamin A on subsequent days immediately after diagnosis of measles. For how long is a person with measles contagious? Measles is highly contagious and can be transmitted from 4 days before the rash becomes visible to 4 days after the onset of rash. For how long is a person with rubella contagious? The most infectious period is usually 1 to 5 days after the appearance of the rash, but rubella may be transmitted from 7 days before to 7 days after the rash appear. How is the measles rubella vaccine given? It is given by subcutaneous injection in the right upper arm. What side effects have been reported with the MR vaccine? The vaccine may cause slight fever or mild rash, some in children. 7-12 days after vaccination, severe reactions are rare. Does one have to pay for the MR vaccine during campaign or in RI? No. MR vaccine is provided free of cost during the campaign and RI in all government health facilities. Why MR and not MMR? Measles, mumps, and rubella vaccination? There is not enough evidence to suggest the mumps is a disease of public health importance in the country. Therefore, only MR vaccine is being introduced. MR vaccine introduced in routine immunization during MR campaign measles or MR vaccinations to be withheld during routine immunization sessions. After the MR campaign is completed, MR vaccine will be replaced measles vaccine in routine immunization. Will MR vaccine be given during routine immunization? Every children in 9 to 12 month age will be given first dose and second dose of MR vaccine between the age of 16 to 24 months. After completion of MR campaign, 2 doses of MR vaccine will be given in routine immunization at age of 9 to 12 months and 16 to 24 months. Does the child need MR vaccination campaign? Does even if she or he has had all her or his routine vaccination? Yes, the campaign does will be administered to all the children falling between the age group of 9 months to less than 15 years of age, irrespective of any past history of disease or vaccination. MR campaign does is in addition to RI dose. What should be the minimum time interval between a routine vaccination and campaign vaccination? If the campaign dose is due as per the guideline, it will be given irrespective of any gap between the last RI received by the child, as this is a one time activity and there is no harm done to the child with an extra dose. An 11-month-old child has got 1 dose of measles vaccine through routine immunization 1 week before start of campaign. Should the child get the campaign dose now? Yes, the child should be immunized with the campaign MR dose too. There is no added risk of side effects because of the second dose. In addition, the child should be brought for routine second dose of MR vaccine at 16 to 24 months of age. A 14-year-old girl is having menses. Should the girl get the MR vaccine during campaign? Yes, this girl should be immunized with the campaign MR dose. There is no harm in vaccinating the girl who are having menses. If a child due for measles vaccine come to the routine immunization session during MR campaign, should the child receive measles dose? During MR campaign, measles vaccines in routine immunization will be withheld. No measles MR vaccination will be done during RI. MR vaccine will be introduced in RI after completion of campaign. However, ANM should be ensured that child receives MR campaign as during the campaign period. Which child is eligible for MR vaccine under the routine immunization? Every child who is eligible for either first dose or second dose of measles vaccine in his or her RI schedule will be provided with combined MR vaccine in place of measles only vaccine. If a child received 1 dose of MR vaccine during the MR campaign, should he or she receive the routine dose of MR vaccine? Yes, the child should receive routine doses of MR vaccine according to the National Immunization Schedule, irrespective of any MR campaign does it in the past. If a child has received MR vaccine before 9 months of age, is it necessary to repeat the vaccine later? Yes, according to the immunization schedule, the MR vaccine needs to be administered as MR1 at 9 to 12 months of age and MR2 at 16 to 24 months. Till what age MR vaccine can be given to children under routine immunization? Two doses of MR vaccine should be given 9 to 12 months and 16 to 24 months of age. However, if a child misses the scheduled dose, MR vaccine can be given till 5 years of age. Key facts about measles and rubella. Measles kills nearly 49,200 children every year in India. Measles and rubella are highly infectious diseases caused by a virus. They spread from person to person through droplets, mainly from coughing and sneezing. A measles case is infectious from 4 days before appearance of rash to 4 days after the rash has subsided. A rubella case is infectious 7 days before and 7 days after the appearance of the rash. Measles can cause complications such as diarrhea, pneumonia, mouth ulcers, ear infections, damage of eyes, brain infection, and can even lead to death. Rubella infections during pregnancy can cause abortion, stillbirth, and may lead to multiple birth defects in the newborn, like blindness, deafness, heart defect known as congenital rubella syndrome. Unimmunized children are at a high risk of getting measles or rubella infection. Vaccination is the only way of preventing measles and rubella CRS, and this MR vaccine is provided by the Government of India free of cost in campaigns as well as in routine immunization. During the campaign, every child of the age group 9 months to below 15 years should get MR vaccine even if the child has already vaccinated with MMR vaccine either of the diseases. Continue routine immunization as per schedule.